So I think you're touching upon a very important piece about accessibility and affordability of optimal therapies. I think what we've seen during the pandemic is human innovation. So all these therapeutic approaches that we are taking, the paradigm towards getting patients to, MRD negativity and then sustaining it, there is no reason why that, in emerging countries, or emerging economies, there can be innovations that are cost effective that can be developed to help the clinicians. And, part of this innovation will have to come from the physicians, partnering with, folks, in local industries to make this happen, to bring down the cost. That will include, academic institutions, that will include the pharma industry as well. But, I would encourage them to think outside the box and try to think of ideas that will help bring the cost down. These technologies are going to get cheaper and cheaper. And, in the Southeast Asia, in South America, in other parts of the world where cost is an issue, in Central Europe, I think innovation is what will bring the cost of care down